Good afternoon, everyone. Welcome today. I'm Cook County Commissioner Donna Miller, and we are here today for our Lunch with the Experts Town Hall, and I am going to get started in just a minute once we let the audience build some, but we thank you all for joining us today. Appreciate you being here today. So give us just a minute or two for us to build the audience. Good afternoon. We're going to be getting started in just a few minutes. We're going to give the audience a chance to build and let people join us on Facebook Live today. We appreciate you all being here for this important topic in our Lunch with the Experts Town Hall. We'll give it just about another minute or so to get started. And if you're joining us today, please feel free to share this page with other people. And you can start your own watch party if you know how to do that. I'm going to give it about another 30 seconds for the audience to join us today on Facebook Live. Just give us a minute. Well, good afternoon, everyone. I'm Donna Miller. I'm Cook County Commissioner of the 6th District, and I want to thank you for joining us in this important discussion today, centered on World AIDS Day as part of my Lunch with the Experts Town Hall series. So as many of you know, today is World AIDS Day, which takes place on December 1st each year. And it's an opportunity for people worldwide, not just in Cook County and beyond, to unite in the fight against HIV, to show support for people living with HIV, and to commemorate those who have died from AIDS-related illness. In honor of this day, I sponsored a resolution at our last Cook County board meeting recognizing December 1st as World AIDS Day in Cook County. I'd love to share that resolution with all of you. It will be posted in our chat, and so you can take a look at that, because World AIDS Day is an important reminder that to public and the government that HIV has not gone away. And there is still a vital need to not only raise money, but increase awareness, fight prejudice, and improve education. More than 40,000 people in Illinois live with HIV or AIDS, and more than half of those individuals reside in Chicago. And in 2018, which we had our latest numbers from, there were 25,198 people living with HIV in Cook County. Additionally, just as we've seen how healthcare disparities and the social determinants of health among minority communities have led to adverse outcomes during the COVID-19 pandemic, this proportionate impact on HIV and racial and ethnic minorities has been predictably similar. And with the CDC reporting that in 2018, of the 37,968 total HIV diagnoses in the US and 6 dependent areas, Blacks and African Americans accounted for 42% of those HIV diagnoses and 13% of the population, our Hispanics and Latinos accounted for 27% of the HIV diagnoses and 18% of our population. So you can see by those disproportionate numbers that we still have a ways to go. Also of great importance is the Getting to Zero Illinois. It's a statewide initiative that we will hear more of. It was launched in 2018 to end the HIV epidemic in the state by 2030. We've come a long way since the beginning of this epidemic in Illinois. For example, from 2006 to 2017, we've seen a 35% reduction in new HIV transmissions, and we've nearly eliminated perinatal HIV transmission. And of people living with HIV in Illinois, at least 2/3 were covered by Medicaid or the health insurance marketplace in 2017. And so for me personally, I've been involved in this area for most of my professional career. I started working with Burroughs Wellcome. They were the company that made the first breakthrough medication for HIV, which was called AZT. So I've been in this community a long time and take personal, deference to joining the fight to making sure that World AIDS Day is not forgotten, even though the medications have gotten so much better over time, which we are so thankful to so many researchers who've put their efforts towards making sure HIV and AIDS has treatment that we have today. So I want to thank our experts for joining me today, taking time out of their busy schedule to help educate us on HIV and AIDS. And I want to get into our panel discussion. First, we are so grateful to have Reverend Ray Lewis Thornton with us today, as well as Tanya D. Woods, who is the Executive Director of Westside Justice Center, Dr. Pete Thomas, who is the Director for the Medical Support Services at Near North Health, as well as Diane Walton. So first, I'd love for us to get started hearing from Reverend Ray Lewis Thornton, who is an Emmy Award-winning AIDS activist and has been such a wonderful, I've known Ray a long time, but she has been on the forefront of this and really a trailblazer for African-American women and women in general in HIV and AIDS. So Ray, please, we'd love to hear from you. Oh, you're on mute.
Thank you, Commissioner. And yes, we have known each other a very long time. What's so remarkable, I've known you since you were a pharmaceutical rep selling AZT. So it has been a long time. I have been infected with HIV for 37 years. I was diagnosed 34 years ago. And I transitioned from HIV to AIDS about 27 years ago. Most people know me from my cover Essence article, having been the first African-American woman to tell my story on a cover of a major magazine, December 1994. And what's remarkable is the cover said, "Facing AIDS, young, educated, drug-free, and dying of AIDS." And, you know, people say, yeah, but you're still here. And I'm here to tell you that I was actually dying when I was on the cover of Essence. I think at that point, my T-cell count was 8. When they actually shot the photos for me to be on the cover, which was like 6 months in advance. At some point, I was, 8 pills, my T-cell count was 8. I was on, 31 pills a day, and the medicines made me sick. And, it was just, there was very, very little hope for people living with HIV/AIDS, back in the day, back when I was on the cover of Essence. The life expectancy for someone with HIV was 4 years, and I was literally on that timeline. I had an incredible doctor. You know, people say, how did you do this? I had an incredible doctor at Cook County Hospital, Marge Cohen, who was the founder of the Women and Children HIV Clinic. And she fought for me when I couldn't fight for myself. And that, you know, really it. And, you know, people think, oh, because I'm on TV that I'm getting my health care. Donna, you may not know this, but I received my health care at the Core Center because, you know, they have incredible doctors. You know, I went to Cook County, which then they opened Core Center, you know, and I was one of those women who needed care, wanted care, didn't have health insurance, could only get my medicines from the Cook County dispensary. And what my doctor did was, every time Cook County's dispensary got a new HIV medicine, she would give it to me. And I almost quit, not because of HIV per se, but I almost quit, you know, because of the treatment and care. At one point, I'll never forget this. We were, I think it was when I was at 31 pills a day, and I had a horrible bout of gastrointestinitis. I kept throwing up and pooping, and it passed at about 6 hours. And I took a bath, put on silk pajamas, the diva that I am, and beautiful body cream. And I called my doctor, Marge Cohen, and I said, I quit because the quality of my life is more important than how long I live. And Marge started screaming at me, you've got to give me more time. You've got to give me more time. And she had never told me that I was dying, but surely I was. You know, my T-cell count was 8. I was a size 0. I'd had 3 rounds of pneumocystis carini pneumonia, which is the #1 infection that, you know, kills people with AIDS. And she kept saying, you've got to give me time. And what I heard was, if you stop, you will surely die. And I gave her more time. And the deal was, as soon as the next medication came, and I'm getting to a point here, as soon as the next medication came, he would switch me out. And it took a year. And the next medication was a medicine where I had to drink 72 ounces of water a day, or I would get kidney stones. But I did it. And I kept going, and I kept doing what I needed to do to live. And so with a doctor who cared and a will to live, I lived. And I say that it's important because most African Americans, only about 40% of African Americans who are tested for HIV, who are diagnosed with HIV rather, get into care and stay into care. Only about 40% of African Americans we're virally suppressed. And so there's still so much that has to be done with HIV today. African Americans are still disproportionately impacted. Black women are still 60% of all newly diagnosed cases. And so we've come so far when it comes to the care of HIV, the medical science of HIV. But we really haven't come far in terms of attitudes. And so, and I think stigma is a part of that. Remember, I said, you know, you found out that I had HIV 10 years after, you know, I was infected, because I didn't want anybody to know. You know, I kept my infection a secret because I was ashamed. I was ashamed how people would approach me. If I was working in politics at the time, would I be able to get a job? And so I continue to do this work. You know, I'm 57 now. I continue to do this work. But at some point, we're going to have to step up to the plate and take better care of ourselves, especially in an era where you don't have to even transition to AIDS. And so that, that's what I have to say. I'm just happy to still be here and to still be a part of the game. God continues to keep me here, and I continue to do what I do.
Thank you so much, Ray. You do more than just do what you do. You have been so inspirational to so many and have done so much for women. And I'm not just saying women in the HIV and AIDS community, just in general, to be a trailblazer. So thank you so much. We're going to come back to you.
Okay.
But that was wonderful. So next, I'd like to hear from Tanya Woods, who is an attorney and the CEO of the Westside Justice Center. So Tanya, please just elaborate more on your background, and please give us your speaking point.
Yes, absolutely. And thank you, Commissioner, for having us. Thank you for creating this forum. Ray, you are just, royalty in this space. So I'm glad to just be sharing the airwaves with you. It's certainly a pleasure. And thank you to the viewers. Regardless of how many people are out there, if there are 1 or 5 or 500, this is important information and an important conversation to have. I am an attorney licensed to practice in the state of Illinois, and I have the pleasure of leading a grassroots community-based holistic legal aid clinic called the Westside Justice Center on the west side of Chicago in East Garfield Park. It is not only the home of my work, but it's also the home that I grew up in. I am from the West Side, and so it's my privilege to be able to give back through my talents, through my treasure and my time to the community that birthed me. The important conversation that we're having today is the one that talks about, as Ray pointed out, while we have certainly made great strides in the last 3 decades as far as the medical technology is concerned, and I'm sure Dr. Pete will elaborate in depth on that, we are still at a point where we are experiencing racial disparities when it comes to certain diseases, and this is no, and so that has not changed. And so for those of us who are old enough to remember, the moment that we are living in right now in COVID-19 global pandemic feels eerily similar in a lot of ways. There's a lot of misinformation, lack of information, improperly shared information. We can talk all day about the government's responsibility to address this need, but then what is most challenging, I find, keeps me up at night, is the fact that we as African Americans are still bearing the brunt of some of the worst illnesses and diseases known to the planet. And that is what, makes this a health justice issue and not just a health issue, if you understand. And so when we talk about who are the subjects of important research, who is not only seeking treatment, but getting treatment in such a way that preserves the dignity and the respect of individuals. Ray talked very eloquently about the stigma that still exists. And part of that stigma is, if you treat me like a second class or third class citizen, then I'm not going to want to own up to something that further relegates me or oppresses me or puts me in that underclass. But as we begin to take away and remove that stigma, then we can start to talk openly about what is it and what isn't it. What about my status? The fact that we're now at a moment where we're talking about, did you get tested? Can I see your results? Your employer now may be asking you and have policies and procedures as it relates to COVID-19 about when you can come and go back and forth to work. And so these are lessons that that we can learn from, but also recognizing we are still living on a planet where HIV and AIDS is still present. And what we cannot afford to do is to ease up on that pressure of systems that keep us in the dark, of systems that sometimes we are part and parcel of that we don't even realize. So let's talk about that stigma, right? Why are we still living with that? It's the same stigma that we see in the Black community around cancer or around mental health. These are stigmas that only further to keep us in the dark and keep us oppressed. And so it's opportunities like this that we have to start bringing things into the light and talking about it and saying, brother, sister, I got you. go get tested so we know and we can fight this fight together. And then placing pressure on systems of justice, of healthcare, that make sure that information is still getting out there, that we do not let up on the fight against HIV and AIDS, that we're making sure that information and awareness is still at a granular level in our communities, widespread. I'm always encouraged when I see advertisements on bus stops. But I often think to myself, are people really then going into the clinic and getting tested after they've seen that bus stop ad or that billboard ad? And what more can we do in all places where we work and live to make sure that people not only know their status, but then continue to get the treatment that they need, and that we can have open conversations about HIV and AIDS and how it's transmitted and how we can get treatment and how we can live full and vibrant lives. So for me, this is about a conversation about how we make sure there's equal access to a high quality of living, regardless of what your status is.
Thank you so much, Tanya. You're exactly right. And it's great to have the legal perspective on how different disease states affect you for employment, as well as I know you're going to talk a little bit about the incarceration, especially for women as they're affected by HIV specifically. So next we'll go and hear from Dr. Pete. Dr. Pete is in the trenches, if you will. I mean, working in the HIV and AIDS community every day at Near North Health. And Dr. Pete, we are so grateful for your expertise as well. So please go ahead and take the floor. You're muted, Dr. Pete.
You got me now? Great. I just want to tell my panelists, thanks so much. I appreciate being a part of this discussion. And Commissioner Miller, I think you're doing a phenomenal job by putting this to the forefront, especially in the middle of this pandemic. And Ms. Thornton, you really took me down memory lane about mentioning Dr. Cohen. It was a pleasure working with her at County as a young attending. And so that began my path in treating HIV medicine. And so, but we're still in this fight. And just to let people know, right before the pandemic, Dr. Fauci had a huge conference. He was a part of the Ryan White conference. And the big discussion at that conference was ending the epidemic. And that is my goal, is to, before I retire, to actually see that happen. And it can happen. It will happen. And there's going to be very concrete steps that we have to make. And I don't want to rehash some of the data points that people mentioned earlier, but I think it's important to sort of get a foot for what kind of battle we got ahead of us. So still, African Americans are disproportionately impacted by this virus. Okay, in particular, Black women. Amongst women, African American women make up the largest percent of women, 14 times that of white women and 6 times that of Latina women. And even though we're watching numbers decrease for both Black men and Black women, it is still the 8th leading cause of death for Black women amongst the ages of 35 and 44. And so we're still in this fight, and particularly from a geographical perspective, the South shares the largest burden of the HIV epidemic. Although if you look at the East Coast, which is New York, and then the West Coast is California, and right in the Midwest is Illinois. So there's something about the South, New York and Illinois, and California and Illinois. What's making up the largest part of Illinois is Chicago. And so we go back to this issue of social and health inequalities that exist. And those impact the HIV virus as well. So when we don't have access to care, when we don't have neighborhoods that are safe, when we don't have housing, decent housing, all those things impact HIV care. The medicines are phenomenal. And I love Ms. Thornton, when you mentioned about the amount of side effects that our patients originally used to experience. These medicines now are fantastic. We have a fantastic cocktail that exists in one tablet that patients used to take. I imagine my patients taking 18 tablets versus the one tablet that they have to take now. And so when we embark upon this sort of new journey, I think it's important for us to remember what we went through in the past. And I say we because I lost many of my family members, and many of the people that I worked with in this fight were lost in this battle. But what we're excited about is getting to zero. And getting to zero is that comprehensive plan that is a part of ending the epidemic, but it is Illinois' plan to end the epidemic. And it is a private and public partnership that allows us to put together these concrete pillars that will get us to that zero. The plan is to have zero new HIV transmissions by 2030. The plan is to have zero people that will not have access to care who are HIV positive. And so these are very realistic goals, but obviously it's going to be a huge push. And so when COVID came along, I think it's important for us to know the reason why we got so far with COVID was that we were working on the HIV virus, finding a vaccine and a cure for HIV. They just turned all those labs into COVID labs. So, and I think we owe this work and all of the advances that we did for COVID to the researchers and scientists and the people that were in this fight for HIV. So I'm excited about that. The other critical part of getting to zero that I want to mention is this issue of PrEP. And PrEP, contrary to what some people say, is not just a pill. It is a comprehensive educational, counseling, and pharmacotherapy program that will prevent new HIV infections by taking this one tablet. It's called Truvada, and it's also called Descovy. And I think that is that plan that will help us to get to that zero. And I think it's also important for us to recognize that these social inequalities that impact our healthcare system has to be addressed in order for us to get to that level of ending this epidemic.
Thank you, Dr. Picos. Statistics are something that I don't think we hear about every day at all. And also the information about PrEP. So I know we'll go back to that in just a little bit. So thank you so much. And next we have Diane Clements Walton, who has been another person on the forefront of HIV and AIDS for decades, worked at the Core Center. So Diane, we're so privileged to have you join our panel as well. And would love for you to come on and just talk about your experiences. You've published many papers related to HIV and AIDS, and the impact on African American women is not something new. It's something you've been dealing with for decades. So thank you for joining us, and please go ahead and unmute and we'll have you come on. You're still muted, Diane. Diane, you're still muted. Diane, you're still muted. Hold on a second, Diane, we can't hear you. I know she's saying some great things, but we can't hear her right now. Hold on, Diane, we're gonna call you on the phone, I think, because we can't hear you. Can you unmute your, it's right down at the bottom. Yes, okay, you're unmuted now, Diane, go ahead.
Good afternoon. While the world grapples with the attendant devastating effects of HIV and the raging COVID-19 pandemic, the World Health Organization continues to re-echo that persons with comorbidity like HIV, tuberculosis, and diabetes are at a higher risk of coming down with the disease and dying. However, the more devastating is the access to care and getting care. Most of the patients that were HIV positive and have AIDS were very proactive in getting their care. But now with COVID, everyone's afraid to come out. Everyone's afraid to see the doctor. Most of them don't have any access to webcams and phones where they can have phone calls with their practitioners or phone video calls. And so therefore they're limited. Most of them are mothers and have children. Now they have e-learning. So they spend all day with the e-learning and they still are unable to make their clinic appointments. So women and girls are most affected by this disease and by the pandemic because they have the lack of resources in order to get help. The World Health Organization notifies that according to 1.7 new HIV infections and 600,000 deaths from AIDS-related illnesses globally, 38 million people living with HIV and more than 12 million people with life-saving treatments. This pandemic has caused to shut down, to shut in, and so therefore, since you don't have nothing to do and you can't go nowhere else, then you do unsafe practices. If you have not stocked up on a supply of condoms, there's nothing for you to use because you can't get out. We talk about food deserts, but we don't talk about deserts of our pharmacies and of our drugstores where you can go and get access. Most of the pregnant women miss appointments, especially if they have to come every week, if they have to come every month. If I just have enough money just to get to one appointment, then I'm doing great. But most of our pregnant women have never been in the system, so therefore they can't access the system. If they never made one appointment, then they can never get a phone call. They can never get a face-to-face because they have not been in the system. And the same thing with HIV. HIV, when they struck, the first patient I had was a pregnant patient. This was her third pregnancy. 2 of her children were HIV positive, but they seroconverted, but the last one didn't. And that was my first case. I was terrified, but I finally learned they were patients like everybody else. They was just devastated by this disease. And if we don't act like they're part of the community, then we will always have problems and always have issues. Women are caregivers. We take care of families. We take care of our parents. We take care of the neighborhood. We cook, we clean, we do everything that we need to do. But getting health care has always been a problem for women. Because even if you come to a lot of the clinics, they don't have places for your children to play in, anybody to sit and watch the children. So therefore, you can't get the care that you need because you got to constantly babysit and watch your children. We as a community need to do a better job in protecting women and girls and making sure that they have the access to care and treatment that they need, that they have services that they don't have to go across town to get. They can get services right here in our neighborhood. Most of our in our neighborhood have to go all the way to Stroger Hospital or to the Core Center or to U of I or to Rush or Northwestern because that's very limited out near in the suburbs where they need to go. So we need to do a better intake on taking care of women and girls. But then at the same time, women and girls should not feel that it's a disease that I'm personally responsible for. So it's my problem and I don't need to go and deal with it. And that's where a lot of them feel. They feel that it's my fault. So, why should I go and get taken care of? Now with COVID on, you can't fight what you can't see. And that's another devastating blow because they do everything sanitize, wash your hands, wear a mask, social distances, good ventilation, and then they still might come down with it. So now, that comes the mental health piece. A lot of them do need mental health care, especially in this time of COVID and the fact that they are isolated from family and friends, from help for medical care, from stores, from shopping, from this. They don't have porches they can go stand out on for 15 or 20 minutes a day. They're constantly in their houses. And so it's becoming a problem. When COVID first started, we pushed every health issue to the back. We didn't talk about HIV. We didn't talk about AIDS. We didn't talk about PrEP. We talked about none of that. It was COVID, 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 COVID. So we missed the hard people. We missed the diabetic people. We missed the people with neurological problems. We missed the pregnant people. We missed all kind of people because we were constantly gearing on COVID. And with our people in general, if you don't keep it forefront, they will forget. They will not access because you're not constantly bringing it up. You have to be a constant reminder. So I don't know how we can fix that because now we have testing for COVID, but we didn't not have that type testing for HIV in our communities. You had to go to a doctor, you had to go to a clinic and get that. We didn't have those walk-up clinics and those drive-through clinics, and so that's where a lot of people are lost in the system because we don't have that type of access. And so that is something that we need to look at as a way to getting more people tested and then getting better results. At the same time, they come and get these tests, we can be a resource and have information there that they can access in order for the care, for care. So as a woman, I know that my priority would always be my family and will always be my children. My health will come third and fourth. That's not a priority. Everybody else is a priority and not me. And so that mindset we need to change in our communities because this has become a major issue in care for our girls and for our women and for healthcare in general. When you feel that everything else is a priority but your life, then you act accordingly. You give everybody the best foods, you eat the less. Everybody sleeps in the bed, you sleep on the floor. It's just little things like that our community needs to better equip our women and girls with, and our families in general. COVID is not going to go away for a while. And as long as we're not washing our hands and wearing masks and social distancing, because we don't think we ever going to catch it, it's going to rage on. And as it rages on, HIV rages on also. And so we got to be proactive. We got to use those community resources. We got to use those government resources to help us in this plight and in this situation to deal with HIV. Today on World AIDS Day, let us make a commitment to be more responding to the needs of the community when it comes to HIV. And I guarantee you, if we get into a lot of that responding, we will take care of some other health issues. But if I don't have any issues and everything is closing down and the nearest hospital is 12 miles away, it is a problem. It's a problem. A lot of times I wouldn't see my pregnant women. Okay.
So thank you, Diane. Thank you so much.
Because there was no access to healthcare. Thank you.
Those are some very important statistics. And so we are going to post some of that information in our chat room so people can go back to that. But real quickly, so we have about 20 minutes left. I'd like to go back to each one of you. And first of all, I think it's important to go through and just kind of clear up what some of these acronyms we've said are, because we know what we're talking about, but some people might not. So Ray, if you could just start us back up, we'll go through, first I'd just like for you to just tell us what HIV, Dr. Pete mentioned, it's a virus. We keep hearing about coronavirus, but people aren't thinking HIV might be a virus, or they might have forgotten that. So HIV, AZT, what was AZT? And then Ray, if you could also talk about, I want each person to talk about the effect. We talked about these devastating numbers, the increases Dr. Pete mentioned of HIV and AIDS on Black women, and Diane talked about pregnant women. If each one of you can talk about what can we do today in our respective roles as different people in the community to get women, especially Black women, tested. So Ray, we'll start with you.
Okay. So HIV is the virus. It's a thing. That's how I describe it to young people. It's a thing. And in the early days, that much about HIV. In fact, it took, the first cases we saw were 1981, and they were AIDS cases. And it took about 4 years for them to even to figure out the thing that was causing AIDS, which was the HTL2 virus thingy. It had this clinical name to it, but that the HIV virus is the thing that causes the disease AIDS. And so when I was infected, back in the day when I was infected, and Dr. Pete talked about that a little too, when I was infected, what we knew about HIV was this. They would take someone 8 to 10 years for HIV to actually destroy your immune system. And once your immune system is destroyed, you then have AIDS, because all AIDS is being immunocompromised, not having an immune system to help you fight off. It's a whole list of infections that we would call opportunistic infections. This is why testing is really, really important. So back in the day, all we had was, we knew that a person would transition to AIDS. It would take 8 to 10 years. And we knew that once a person transitioned to AIDS, life expectancy was 2-3 years. If you had lived 4 years, I remember being on Oprah, and I'd been with AIDS for 6 years, so I was a long-term survivor. Now, I've had AIDS for a very long time. But the treatment and care, we started with AZT, which was the first HIV medication, and now there are over 30 HIV medications. And, I took that first generation of AZT. In fact, Dr. P, I took the first generation of every medication, of all the different classes of medications, and they were very, very aggressive, and they had a lot of side effects. And, now no one prescribes AZT as a single drug anymore, because there are 30, some HIV medicines. And so the key here is this, that you cannot get into treatment if you do not know you are infected. And so testing is still so critically important. And I hadn't really thought about it until Diane said it. We're all sequestered in. I have thought about everybody, getting room on for real in COVID lockdown. But clinics have been closed. Where do you even go get tested now? That, you got to get your temperature taken to go into the core center. And so right at this moment, during this COVID epidemic, we have more challenges around HIV. But the bottom line is this. This is the bottom line, that we must get tested for HIV, because if you know your HIV status and you get into treatment and stay into treatment, you may never transition to AIDS. And so all of those opportunistic infections that I had, wasting where my body couldn't maintain muscle fat, and I ended up going from a size 12 to a size 0, or having pneumocystis pneumonia. And even though there were medicines advanced by leaps and bounds. Those first 7 years were slow. It took us almost 5 years to even get the HIV antibody test after, the first cases of AIDS. But now we know, and there is really no reason why a person, anyone, can't get tested. Testing is free in most clinics, and to get into treatment and care, because that's the thing that will. And it's disheartening for me that that the numbers among women continue to rise. So here we are.
Yes. Well, Ray, that is an excellent point, that the medications are there and people have to get into treatment. So I'm just going to skip right now, Tanya, real quick, because I just want Dr. Pete to elaborate on that point about getting people in to get tested, because you see this every day. So can you spend a few minutes just talking about that part, and how are we going to get more people, especially women and Black women, tested?
Yeah, and if I could just add one thing to what Ms. Thornton talked about, which was all of the HIV medications, they operate to do one thing and one thing only, and that is to stop viral replication. And so part of that, meaning if you look at each one of the pharmacokinetics of the medicine, is all to stop the virus from hijacking your cells, stopping that cell from producing itself and produce more HIV virus. So right now, the principle of treatment is a principle called rapid ART. The minute you're diagnosed, we want to put you on medicine the day we tell you that you're HIV positive. However, to Ms. Thornton's point, that can't happen if we don't know that the infection is happening. And so one of the things that we're doing is looking at we call it guerrilla outreach, and that is going to very high risk communities, high risk areas of those communities to see where is the virus, where is the new infections happening most frequently. And oftentimes you'll find that it's the communities that are not well taken care of. It's communities that doesn't have decent housing and educational opportunities. So it's not a secret. It's not like people are unaware. Oh my goodness, I didn't know. No, just drive down the street and ask yourself, could HIV flourish here? And it's absolutely yes, because people don't have hope and opportunity. And so then I can tell you right now, in the midst of the pandemic, I've diagnosed at least one person with HIV positive in every single month since April. And so some kind of way, people are still having sex. People still don't have access to PrEP. They still don't have access to educational materials. Because even when I present PrEP to people who are at a high risk, they still have something to like sort of think about. Well, let me see. And so I'm asking, well then, if this is not your prevention strategy, what is? Let's talk about what your strategy is, because I'm not here to like twist your arm, but I do want to help. And let me know what your strategy is, and maybe this is a part of it. So this is kind of my philosophy. And so coming from a community on the southeast side of Chicago, I mean, I understand that everybody does not have, we can't judge folks and then want to help folks. So I'm not in the business of judging people. I'm in the business of helping people. And part of that means translating these sort of complicated scientific principles to how do you make sound decisions for your health. I mean, Black women in our community, still the highest rate of HIV infections besides men who have sex with men. Okay. And so we got to get this message out to our churches, to our beauty salons, that everybody's not being honest about their status. And so it's important that we protect our women by asking them, have they considered PrEP as an option for them? And to Ms. Thornton's point, all those great medicines can't do anything if we don't know that you're positive, and we can't get you on the medicine. Because, and I think we talked about this earlier with the HIV continuum, if we have 1.1 million people in this country who are positive with it, who are living with HIV, only 86% of them are aware of their diagnosis. And of those, only 56% are engaged in care. So we have a lot of growth and opportunity to happen, but we need everybody involved. And I really appreciate Ms. Woods and her organization. I mean, we need all hands on deck to make this happen, especially in the advent of COVID.
Dr. Pete, I mean, those numbers need to be on billboards. They need to be plastered everywhere like it was in the beginning. You know,
Right.
I mean, we used to tell the story over and over and over again, and we've gotten away from that. But that's why and you brought up Tanya's work with women who are incarcerated, who are at more risk. So Tanya, what could we do to educate other people, not just us, because we know that we need that, but how do we tell other people to tell them? And what can we do to advocate for them as well?
Yeah. That's a great point, Donna, and thank you for pointing that out. And Dr. Pete, I'm going to borrow this, so when you hear it and you see it on a billboard, I'll give you credit for guerrilla outreach, because that's exactly what is required. So, you know, you heard Diane talk about Black women and children, right? We are often left behind when it comes to any social ill, right? We're the last group that people think about. We're the last group that is researched, right? I could watch and read Henrietta Lacks's story over and over again, because even when I go to the doctor now, I still have to sign that waiver that says you get all my tissue samples and you get all my this, that, or the other to do studies on, and I may never know or may never be able to fully appreciate the outcomes of some of those studies. So when you talk about Black women and children, especially being on the brunt of this, then imagine that and multiply it when you talk about Black women who are incarcerated. So that what we're seeing in the news now is that more and more COVID cases and outbreaks are happening in our prisons. Imagine what that's like when you talk about a disease like HIV and AIDS, and the lack of care, the lack of testing, the lack of connectedness with your community, and how people who are incarcerated are impacted. The people who are incarcerated, they tell these stories to their loved ones when given an opportunity about how they are not getting adequate treatment or adequate care, let alone testing. So we on the outside, what we can continue to do is apply pressure on those multiple systems, just like Dr. Pete talked about. When we're not healthy, then when we're not cared for as far as housing, when we are not well educated, then all of our communities crumble. And when our communities crumble, so does the larger society. So I think very early on in the commentary, you heard somebody talk about we have to take care of ourselves. If there is any great lesson in this pandemic that we can all learn from, is that when we decide to take care of ourselves, then we are unstoppable as a people. So that means just like you put out the Get Out the Vote and all of the materials that went around that, we have to have that same type of guerrilla outreach when it comes to taking care of our bodies, of our health, and of our communities. It's that same, like, go take somebody to the doctor. Go make sure that they get the right pamphlets or the right information to make sure that they're tested. If you know that there is somebody that you have in your sphere of influence that is incarcerated, make sure that you are doing whatever you can to work with their team to make sure that they're getting the health care and the services that they so desperately need and deserve. And then if you are so fortunate to be part of the community that receives somebody who comes out of a carceral institution, be sure that you connect them with resources and supports when they come out so that they can get the services, healthcare and otherwise, that they need and that they deserve in order to either get healthy or remain healthy. And that's where all of this really comes together, because I'm sure some of your viewers and listeners are like, why do we need an attorney on this panel? Or why do we need to talk about justice? Because justice comes in many different forms. It's not just about criminal justice. It's not just about social justice, but healthcare justice is one of those areas where we are definitely lagging behind as a people as far as awareness, education, and advocacy. And we can certainly need more, use more of that when it comes to this very, very important issue of HIV, AIDS, and awareness. And these lessons we can learn and apply to others as we go forward. And thank you, Dr. Pete, for pointing out that some of those very same labs are now transformed into laboratories laboratories that are helping us combat COVID-19 and the ravishing outcomes and impact that it's having on our communities especially.
Thank you, Tanya. That is another, wonderful way to tie all this together, because we all are the community, and we all are people who are in the community, know people in the community. We have to help. So Diane, just real quick before we wrap up, we have I'm going to extend, if you guys are okay, past 1 o'clock, a few minutes, because this was just so good. But Diane, talk to us again about, what Ray mentioned about how the difference between HIV and AIDS, and why we need women, especially Black women. I keep saying that because that's the market we want to reach, to understand the importance of being tested. Go ahead, Diane.
Well, since I don't with the mental health issues coming in with us, and not being able to get out, not being able to get the resources even to us, we have to go where we can get the most help for our people. And so we need to look at people get HIV with HIV status and not going to AIDS if they can't get the treatment and the services they need, and keep them undetectable as much as we possibly can to prevent the spread. Get more information out there about PrEP, how to use PrEP, and to use PrEP, and just in general, we just need to be tested, because when you get tested HIV, 2 to 1, you have some other health issues you never knew you had. So you whole physical from the top of your feet. Tested with HIV/AIDS that you have. Test.
That's great. You're right. Well, thank you so much, Diane. I want to thank you all for being here. And Ray, I'm just going to have you close us out. Not only because you're Reverend Ray, but also because you have been in, as a patient, as an advocate, as a Emmy Award-winning activist. Just leave us with some parting words. And I just want to let the audience also know that we have all different websites of everyone who is speaking today listed in the chat. And Ray, if you also want to share with us what you're working on next, I think that might be great. And please close us out. I want to thank you all for being here today. I want to thank our audience for listening in. Share this information, because just because it's World AIDS Day today, it does not mean that we can stop the fight for HIV and AIDS moving forward after today. So thank you again for joining us. And Ray, please close us out.
I want to make one point about, before I go to that, I just want to make one point about getting tested. When you go to the doctor to get your annual physical, they do not automatically test you for HIV. You must request an HIV test. And so I want you to be mindful, because some people say, oh, I get tested for everything when I go to my physical yearly. No, you do not. If you do not request an HIV test, you do not get tested for HIV. And everybody needs to be tested for HIV. Mama, grandmama, boyfriend, husband, whoever. Because you, at the end of the day, you just don't know. People have watched me on this journey, this public journey with HIV for 27 years, TV, magazines. But the reality is that I am still living with this disease. Dr. P, unfortunately, are not one of the people who take one pill a day. I take my HIV regimen is 8 pills a day. And then I still have other stuff. We talk about mental health. Most people with HIV, deal with some kind of depression. So people say, what are you doing? take my medication. I make sure my spiritual health is intact. I make sure that my mental health is intact. I have a therapist. I have a psychiatrist. I'm on antidepressants, especially in this era of COVID. And I, find safe spaces for me, reading and knitting and, other ways to keep myself thriving, living with this disease. You have to, consider the whole sum total of who you are when you are living with the disease. And that's what I want you to know, because it is difficult, but we are all capable of doing it. The last thing is this: I'm working on my memoir. Many of you all know, you've been watching me. Hold on, it will be here in the spring, Unprotected, where I talk about my journey to HIV, how unprotected and validated I was as a young child, and how that crafted how I thought, how it crafted health disparities even for a person living with HIV. Commissioner, thank you so much. Thanks to all the guests, this is my show, all the guests, and everybody had something really, really significant to say. If you take anything away from this topic, you can live with HIV, but you must get into care. You must stay into care. You need some place to go to the core center. You have to get tested. Know your HIV status. Take your girlfriend with you. Take your boyfriend with you. But you do need to. Thank you. And check me out at Realty on Instagram and Twitter.
And we'll put that in the chat too, Ray. Okay. We'll put that in the chat. We can put that in. So unfortunately, you were breaking up a little bit, but we still heard you. We heard most of everything you said. So, I know. I'm sorry, but we couldn't cut you off. But thank you so much. We got the gist of it, and we will probably need to do this again in a couple months, and maybe we do a mid-year World AIDS Day just to focus on what's changed. And also, every one of you has mentioned the impact of COVID-19, especially on our healthcare, but this very segmented population. So let's keep that conversation going. Everyone who's listening here today, share the information, share the content of what the information is, and know your status on this World AIDS Day. Thank you so much.
Thank you.